My name is Joan Devlin. I'm Chief Executive of Belfast Healthy Cities.
My name is Bernadette Cullen. My background is in public health. I've worked with Belfast Healthy Cities on many occasions.
We did have the first Healthy City annual business meeting here in 1989 when we still had the barricades in the city centre.
I think there's been a huge change in Belfast and in Northern Ireland since that time. We've obviously had the peace process, so it's very different from how it was back in the 80s.
Part of our role has been to look at how cities are addressing particular health issues.
I think the team has been the most important thing to drive forward the work of Belfast Healthy Cities. As you say, it's a small team, but it's a team that have always been dedicated to the work.
You know, there are lots of influences or lots of new concepts that we've brought to Belfast through being a member of the WHO network. You know, the concept of health impact assessment, active travel, healthy ageing, all of those came through the WHO network. I think we have benefited enormously from being a member of the World Health Organization European Healthy Cities Network.
I think it, first of all, links us in to a large network of cities, over 90 cities across Europe, who we can learn from and who can also learn from us. It works both ways, and I think that's very important.
We've had direct access to expertise, to evidence, for example, the evidence on some of the public health issues. We are kept informed of the emerging public health issues.
We have the opportunity to introduce new ideas into Belfast that we haven't had before, that then can be taken up by others in other sectors across Belfast and can lead to much improvement across the city.
It has been an opportunity to create a very positive image for Belfast within WHO and globally. Belfast has been invited to represent the WHO network, for example, at the World Sustainable Summit in Johannesburg way back in the early noughties. The visibility for Belfast has been very positive as well, and we've been able to share a lot of our very good work.
I think that is the big thing about Healthy Cities. It is very much about partnership. Going back to 1988, Belfast Healthy Cities was one of the first big intersectoral partnerships within Belfast, and those partnerships have all grown stronger and expanded over the years. But what it does is it brings together different sectors to realise that they all impact on health. Health is not about health services, it's about how we live, where we live, housing, economics, education. One
of the highlights, I think, was hosting the international conferences here in 2003 and again 2018. The 2003 was a significant conference. I think we had almost 900 people there, and I think we do need to remember that we're probably the only organisation that has brought WHO conferences to Belfast.
We still have a long way to go, and I think that's what we realise when you work in public health and in partnership, that it's a very long-term process. It's not something that's going to make a change in the first 5 years or even 10 years. It's about constantly keeping going and building on what you've done before.